Thank you. Here we are. So I'm concentrating on cases we've seen here in the parasitology lab. So don't be alarmed by a couple of tables. This is just for introduction to show you that there are a lot of parasites which can affect the eye. Uh, And I'm going to be concentrating on the clinical aspects rather than the lab aspects of some of these parasites. So these are the nematode parasites. I won't read them out. Cestodes and trematodes, the ones that can are well known to affect the eye. And then there are the arthropods and more unusual parasites like the pentastomids. So now this case, many of you would have seen it because it's one of my favorites, especially if you've done our ID courses here at NICD or the DTMNA. So I apologize for that. So I'll go through it very quickly. And Jeremy, you were also involved to some extent, you'll remember. So this was an American woman who was working in wildlife conservation. She'd previously been in a place called Bamasa in the Northern Republic of Congo. At this time, she was at Mfui in the South Luangwa Game Reserve in eastern Zambia, which we know well from another case of a different disease. But she felt some pain and tenderness at her left upper neck area and pain around the next eye, about the left eye. The next day, she felt a bit better, but having breakfast with her husband, he noticed that her left eyelid was swollen and what looked like a distended vein in the eyelid. And looking more closely, he thought that the vein was moving under the skin. So he whipped out his trusty cell phone and made a short video. And so they were in a bit of a panic. They got some blood tests done in Lusaka, and really you can see the thing of note there is the eosinophil count, 1700 per over 1700 per microliter. So in the region of hypereosinophilia. Otherwise, nothing too dramatic on the lab side. So this is where she originated, and the the um, the most likely diagnosis was loiasis, and at the time they didn't know what the diagnosis was, so they made preparations to fly back to the USA. They got some advice uh, uh, via Jeremy from the University of North Carolina not to panic, but rather come to Johannesburg. So that's what they did, and we got the full history. So as she worked up, and let me just get the pointer here. Um, this area of the Republic of Congo, just where the Central African Republic and Cameroon and that country come together, and you can see it's more or less the epicenter for loiasis, for lower infections. And clinically, it fitted very well with that, with the subcutaneous worm and the eosinophilia. And we did look at her blood, but couldn't find any microfilaria. So this was clearly just an adult infection. So this is a summary of loiasis in one slide. It's a filarial disease. The parasites transmitted by tabanid flies, which breed on forest floors, the moist covering of forest floors. They produce they're blood feeders. They produce painful bites, as you can see on that person's lower legs. The classic presentation is either calabar swellings, where the adult worm induces an inflammatory reaction transiently as it moves around, and there's a calabar swelling on the patient's right hand here, and you can see the difference compared with the left. The other classical presentation is the worm moving across the surface of the eye under the conjunctiva when it can be removed, as you see there. So in a patient with a patent infection, in other words, producing offspring, if you look at the blood film, you might see on a wet prep the microfilariae swimming around, and on a stained blood smear at the bottom right-hand corner, that's the appearance of the microfilaria. Use the features of that to identify definitively the parasite. So here's another filarial infection. This patient presented to the ophthalmologists at Helen Joseph Hospital quite a long time ago now. And this patient had a progressive loss of vision in his right eye, particularly when he was waking up. He was aware of that and felt a bilateral ocular pain deep inside the eye. There was some photophobia and a headache. And on further questioning, it turned out he was from the DRC originally, but had been resident in this country for a couple of years. He was unemployed and um, had had this eye pain for a couple of years, where he had been seen at another public hospital. He had been given chloramphenicol eye drops or ointment at each visit and was told that the doctors couldn't find anything wrong. But on this presentation, a slit lamp examination was done, and um, the image was filmed. Uh, should start about here, I think, shows the clear. So what you're looking at here is the light from the slit lamp illuminating the cornea. That's that bright line on the right, and then the light falling on the iris, and the dark hole in the center, of course, is the iris. So if we run the video, we can see little white things swimming around in the anterior chamber of the eye. Now, some of that anterior chamber fluid was aspirated and sent to us at NICD, and we put it under the microscope, and this is what we saw. A microfilarial parasite jiving around. So I thought I'd give it a little bit of a soundtrack here, because it dances quite nicely. So this patient had onchocerciasis, which is a filarial infection found in Africa and the Arabian Peninsula in the Yemen, transmitted by biting flies of the Simulium genus, commonly known as black flies. They breed in fast-flowing upper waters of major rivers in West Africa, and the adults are transmitted by the black fly bites and congregate in nodules under the skin, subcutaneous nodules. You can see bottom left there. the microfilariae are not in the blood, but rather in the dermis, and they excite a severe pruritic reaction, um, and the patients itch madly and scratch and get secondary bacterial infections. Now, when the nodules are particularly close to the eyes, the microfilariae get into the tissues of the eyes. So there's a nodule on this young boy's head, and over a prolonged period affect all the tissues of the eyes from the cornea all the way back to the retina, and the eventual result of that is blindness. So in areas where the disease is common, you see blind adults being led by children who have a high risk of becoming blind themselves. So we haven't got time to go into the public health aspects, but there has been a major effort to control this disease for many years. So this is a patient who originally came from Malawi, and I don't know the background, but he was awaiting trial as a prisoner, but he presented at Chris Hani Baragwanath with a painful left eye and some deterioration of vision, a shortish duration. The visual acuity was down on examination, and the eye was inflamed with the fibrinous reaction in the anterior chambers reported by the ophthalmologist. And they also did the slit lamp examination, and these are some of the photos they took. So at a lower magnification on the left, looking from the side of the eye, you can see the slit lamp illuminating a little worm-like structure on the inside of the cornea. So inside the anterior chamber, but attached to the cornea. And on the right, there's a magnified view of it. So they put a curette into the anterior chamber and scraped the structure out and sent it to us at NICD. So under the microscope, this is what we got. You can see it's a segmented organism. It unfortunately sustained some damage during removal. So some of the head portion, that's at the lower left, was left behind, probably in the eye or along the way somewhere. And so some of the important structures were missing, but we could deduce what should have been there. These are some more of our photos showing the segmentation, well-developed gut, and there's the rear end of the worm. So what is this? It's a pentastomid, and pentastomiasis is not common in humans, although it's well described in certain forms. So it's mainly a disease of animals, and it's got various synonyms: porocephalosis or tongueworm infection. In Sudan and the Middle East, it's known as halzun, or marara is another name for this disease. So for a long time, these parasites were a taxonomic mystery. At some point, they were thought to be a type of arthropod, but now they're classified as primitive crustaceans which have adapted to a parasitic existence, and they belong in the Pentastomida phylum, and there are several genera and many species. The important ones, as far as humans are concerned, the ones that cause most infections in humans, are Armillafer armillatus in Africa, Armillafer moniliformis in Asia, and then there in the Middle East and elsewhere, there's another species called Linguatula serrata. But there are many other species which primarily infect animals. So as far as Armilifer is concerned, this is a snake parasite, and the adult worms, if we can call them that, live in the gut of in the lungs of the snake. The eggs are ascend the respiratory passages of the snake to the mouth and are then swallowed and land up in the gut. And eggs are excreted in the snake feces, or sometimes, I guess, the eggs emerge directly from the oral cavity of the snake. And the eggs in the environment then are eaten by the intermediate host, which is a rodent of some sort, which of course is the natural prey of the snake. So when the rodent is eaten, the parasite then gets into its definitive host, the snake. So humans are generally uh, infected when they eat snakes which haven't been um, cooked properly or eaten raw. So this picture shows an infected snake, and the adults are in the lung passages there. That's what they look like. But it's not the adults which affect humans, it's the larvae or nymphs which develop from um, the eggs. And these are the stages of the parasite, the egg containing the embryo. Then there's a larva with these primitive leg-like appendages, and then the nymph. And it's the nymph which, in the natural host, um, is the infective form for the snake when it eats it. So they are called pentastomes because at the head end there are 5 openings, 4 of which contain these hooks, and the 5th hole is the oral cavity. So that's where the name comes from. Now, in the sample, in the specimen we got, the hooks had been left behind in the cornea, probably, so they weren't evident. But these nymphs have this very distinct segmented pattern, and in the natural host, they insist in the various organs of the rodent in these sort of C-shaped structures, or they curled up in a C shape, and there they wait. Now, and the same would happen to some extent in humans, except humans would be uh, an inappropriate host, so they eventually die and become calcified. And when that happens, they can show up on X-rays, and often it's an incidental finding because generally these parasites are inapparent in terms of the infection they cause in humans. It's often found by accident when chest X-rays are done by for other reasons. But you can see there's very distinct C-shaped calcified parasites in this radiograph. So eye infections are well known with these pentastomids. These are not our patients. Uh, these are not our cases. These are published ones, but they're on the subconjunctivally. You can see one of these nymphs, and you can make out the segmentation. And then this was an old publication, I think the British Journal of Ophthalmology, showing a fundoscopy and a sketch of one of these parasites at the below the retina at the back of the eye. So whether our patient had other ones elsewhere in the body, we don't know because he was not accessible for further investigation. But it's very likely that he acquired the infection accidentally, in some way connected with consumption of snakes. All right, so moving on, these are a couple of cases sent to us by an eye clinic in a rural area. Two children, both 7 years old, who'd been playing in the street, the same street. They both felt something hit them in the eye and then experienced irritation and eye pain. And they both had this conjunctival inflammation, lacrimation, and the ophthalmologist noted that there were small larvae wiggling around in the eye or embedded in the conjunctiva as they were attempting to penetrate the eye. And these larvae are very small. You can just make out a little yellow thing at this arrow in this picture. So the doctors collected as much as they could on cotton wool swabs and sent them to us. On the cotton wool, they're tiny little things, very inconspicuous. And under the stereo mic, the most obvious things we could see were these the mouth part with the hooks and the anchoring part of the hooks, the mouth hooks of these larvae. And this is what we were looking at. So the larvae use these hooks to burrow into wherever they're going and gain access to the tissue in that way. So I'll tell you what the identification is in a minute, because this is another case of a 12-year-old boy, also outdoors, and something got him in the eye and presented with a number of larvae in the conjunctiva or just below the conjunctiva of the eye. So this is the photo taken by the ophthalmologist there, and they were sent to us again for identification. So these are larvae, first instar, in other words, first stage larvae of Estrus ovis, which is a sheep botfly. So this fly normally lays its eggs near the nostrils of sheep, and the larvae get into the nasal passages and develop there through a number of stages, eventually pupating when the sheep sneezes out the pupae, and they develop into, or the late stage larvae, they pupate in the environment, and the adult fly emerges. So that's Estrus ovis, and that's we've had a number of these cases sent to us for identification over the years. And sometimes these stories get into the press. This is a story all about a a game farmer who experienced this infection. So as far as the sheep are concerned, as it says here, it's not fatal for sheep, but it does cause discomfort, irritation, and I think it can lead to um, loss of condition in the sheep. Now, this was a patient, Kay, who developed an acute visual loss when she was on holiday in St. Francis in the Eastern Cape. And the diagnosis wasn't clear. She was treated sort of symptomatically, um, and then got to an ID physician, one of our colleagues in Cape Town, who let us know about this case. At the time, in fact, she uh, had a diagnosis from a specialist ophthalmologist, so we knew what the diagnosis was. But you can see all the investigations that were done in the course of getting the diagnosis. So the ophthalmoscopy, fundoscopy, showed is of the affected eye is on the left here, and what you can see is a track below the retina, moving around, going around the fovea, and then around the optic disc, and then uh, landing up down here where my pointer is showing. There's a subretinal exudate and a bit of retinal detachment in this area. Now, the ophthalmologist recognized what was happening here. And in fact, this is a different type of fly larva, a game fly larva called Gildustia. And it's uncommon but known to affect the eye in this way. And the treatment is to kill it using an argon laser. So that's what was done. The the larva was lasered, and the eye. So this is the on the right here is the normal, uh, the other eye, the normal fundoscopic view. So this is an antelope botfly, and it affects various antelope, especially wildebeest. Now, if you've seen wildebeest in the wild, you'll see they often behave erratically and snort and sneeze and shake their heads, and that's because their nasal passages are being uh, affected by this fly larva, and it undergoes quite an elaborate migration in the antelope through the lungs, through the blood, sometimes through the brain, eventually landing up in the nasal passages again. But humans would be accidentally infected when it gets into the eye. Now, this patient was unfortunately also developed a, a retinal artery occlusion, but apparently everything turned out uh, quite well. So the the site of the the dead larva is over here somewhere under this area of hemorrhage, but you can't see very much. And one of our microbiology colleagues a number of years ago, Gerard Veldhagen, published a case or a couple of cases of Gildustia infection of the eye. So here's another worm in the eye. So this was a lady living in Cape Town, sorry, in Durban, who developed headaches, conjunctival nodule and itchiness. She was otherwise well. She had visited Europe and England uh, in the month before presentation and had dogs in all her in her own house and where she had visited, which may be of relevance. That's how she presented. So in fact, it wasn't really a nodule. It was more like a blister or a cyst, subject conjunctivally on the eye. And it's not evident here, but the ophthalmologist noticed that there was something wiggling around inside and excised the structure and pulled out a slender white worm and sent it to us for identification. After that, the patient was fine. That's what we got. So it looks like a filarial worm of some sort, but it's not a lower lower. Lower lower doesn't, uh, the eyes changes of lower lower are different, and the patient had no exposure uh, uh, to lower lower, so that wasn't really likely. So a microscopy that we did showed, and if you look on this picture, you can see these longitudinal ridges, which are typical of this filarial parasite. And on the cross section, where the teguments folded over, you can see the ridges again. And if it had gone for sectioning and staining, this would show the typical features of a filarial parasite as far as the internal structures, the musculature, and then the tegument, which showed these regular longitudinal ridges. And in this particular case, which wasn't an eye infection, but it's the same parasite, we could make the identification morphologically. But on this eye patient, we did some PCR and sequencing and showed that it was Dirofilaria repens, which is a zoonotic dirofilarial infection, uh, quite well known to occur in humans in other parts of the world, but not in this country. Uh, So these Dirofilaria infections, the most well-known one is Dirofilaria immitis, which is the dog heartworm, which is not a problem of dogs in this country, but is a major problem in the northern hemisphere. And the importance of these is not in themselves, but it's because they mimic other diseases and often misdiagnosed as tumors. And that's their real importance because these humans are dead-end hosts. They can't, the parasite can't reproduce. And in the lungs, Dirofilaria immitis, dead calcified ones or inflamed nodules can look like secondary tumors in the lungs, and that's what they're commonly initially mistaken for. They sometimes adults can get right into the eye. Here's a worm, adult Dirofilaria in the anterior chamber of the eye. So in our patient, it was in the con conjunctival layer of the eye, or just below that. So dog heartworms are a major veterinary problem. So these dirofilarias are transmitted by Aedes mosquitoes, the same ones responsible for some arboviruses and yellow fever and um, chikungunya, dengue. And dogs can be severely infected, can be a fatal infection. So dogs imported into this country need to have a veterinary certificate declaring that they are heartworm free. So as far as repens is concerned, in fact, the veterinary literature has reported one dog and one cat in South Africa. So the parasite's around, so we can expect occasional human cases. And really the importance is that misidentification, misdiagnosis can lead to unnecessary interventions. So I think this is the last case. This was a Midrand resident, a lady who complained of feeling something attached to her eye under the eyelid, which was slowly enlarging. So she got an ophthalmological consultation, examination, and this thing was removed under local anesthetic. And it quite often happens when the surgeon is not sure what they're looking at. It was sent to the histopathologist who sliced it up and stained it, but didn't know what it was. And we were asked to help with this. So we got the sections, and this is what we saw. And it wasn't immediately evident as to what this was. We thought it was some sort of arthropod simply from the general structure. And in some of the tissue which had also, the eye tissue which had been removed at biopsy, we could see mouth parts embedded in the tissue, which is those sclerotized structures you're looking at there. So we asked for a bit more information as to what exactly they saw, and the ophthalmologist sent us a video he had taken. So what you're looking at here is the patient's eye, and the irritation was up on the superior lateral side of the eye, and this was just prior to removal. And there's with the injection of local anesthetic, there'd been a bit of bleeding, so that's what's happening there. But let me run the video and see what you think. So that was the culprit. Now, I think if that had been removed and sent to us whole, we would have got to the answer a bit quicker. But what you can see here is this sort of bulbous structure and little legs waving as the surgeon is preparing to remove it. And it became clear to us from this video and from what we were seeing in the sections that this was an immature tick, which had attached to the conjunctiva, was feeding and growing, and that's why this irritation was increasing in size. Probably what happened was a very small early stage, these these larval ticks, which are tiny. These are what's commonly known as pepper ticks. Probably one of them had got into her eye accidentally, attached, and started feeding, and then uh, started developing further and growing larger. And that's what would eventually have happened if it had been allowed to carry on. So we've seen a number of nematode parasites, as we've said, the filarial infections, uh, a number of arthropods, the fly larvae, and the ticks, and one crustacean, I suppose we have to call it now, the pentastomid. What we haven't seen more of, actually, which is interesting, is cestodes. So these are tapeworm larvae. So Teniosolium cysticercosis of the eye is well described, but we've never had a case. So these aren't our photos. These are published ones. What another cestode parasite which commonly affects the eye is Taenia multiceps and related species, and that forms a cinereus, which has got a different structure to a cysticercus, with its one invaginated scolex. In this picture, the cysticercus, the scolex is actually popped out, but normally it's inverted inside the fluid-filled bladder. Cinereus has got multiple scolices on the inside of the cyst, and this is really a parasite of dogs and herbivores, sheep and goats, and humans are accidentally infected. So we haven't seen a case of eye infection with the cinereus, but we have had helped with the diagnosis of a couple of cases of neurocinurosis, where the cinereus has been in the central nervous system in the form of a type of racemose or um, um, subarachnoid infections, where we were able to show, in fact, first cases of a species called um, Taenia. Um, I forget the name. Sorry, it's just gone out of my head. Anyway, not the usual one, cerealis, Taenia cerealis, which is known to be an animal cause of to affect animals. But these were some of the first human cases, certainly in this country, and a very uncommon form of this disease. And I think that wraps it up for me. So I'm happy to answer any questions, of course.
Thank you so much, John. That's a really, really great overview. Some complicated stuff, and as you say, it's um, really rare in many cases, but wonderful that you're able to diagnose and get so many good images of so many of them. I see there's a question in the chat. In fact, sorry, Charlotte actually typed an answer, but asking about, I think it was with the sheep bug fly, where the children, did they have flies fly into their eye and deposit the larvae? So is how do we get the larvae into the eye?
So it's quite interesting. The fly actually sort of dive bombs and releases the eggs while in flight. It doesn't have to sit on your eye and deposit them. It does a Stuka attack sort of thing, and sort of releases a cluster of. It's like cluster bombing. It releases a cluster of up to 20 of um, these tiny little larvae into the eye. Yeah, so it obviously has got very good bomb aiming ability.
Yeah, train the Air Force on it. And then I guess why don't we see more of it then? Is it just those only those particular areas where these flies are, or it seems
Yes,
that should be more common.
it would be in farming areas where it would normally be affecting sheep, and the humans are just accidentally. In fact, it's probably the most common form of ophthalmomyiasis. The I think the antelope botfly cases are very much less common.
Mm.
But
Uh,
Jeremy, I think you had was it you had a case of hydatid of the orbit, or am I thinking
yes,
of
it was. It
someone
was
else?
yes, it was orbital, but not ophthalmoplegic. Whatever the word is. In other words, it was behind the eyeball, um,
Yeah,
in the
yes,
orbit. Yes, yeah. It
yes,
was pretty dramatic. He presented with a very, very, very proptosed eye, and shame didn't recover full use of that eye either. There'd been quite a lot of pressure damage to the optic nerve by the time he came to see the ophthalmologist. But yeah, no,
yes, yes.
pretty dramatic view of it on MRI as well um, and on surgery. I'll send you the images, John. You can add it to your slide for next time if you want. And then so Patrick was asking about, I think in the same about the same subspecies, the sheep butterfly, was can that actually cause blindness in humans, or did you just get
Um,
irritating larval reaction?
no, it's generally the larvae don't get very far. Uh, I think occasionally you can get more damage, but generally, I think they cause such local irritation that they they are removed at an early stage on the whole and not allowed to penetrate further.
Hmm. Um, and then I see Dr. Salam saying, is there a risk of worsening it with medication use causes? I guess I'm not quite sure, Dr. Salam, we are asking this. So, it was any role of the steroids in that scenario, John, to sort of damp down the inflammation? Or how do you manage
Um,
it if you don't literally remove them manually?
uh, yes, I don't know actually. The steroid would reduce the inflammation, I guess, but possibly allow the parasites to move with less hindrance from that reaction. I don't really know. The um, the the treatment is physical removal
Yeah.
rather than any medical treatment. Yeah.
Yeah.